This is Module 2 in the CASAS course, Machine Learning for Healthcare Applications, Bioethics by Design. This is a course for computer science students and healthcare technology developers, and for any healthcare team members assisting with health technology development. This module focuses on how to embed bioethics principles, and specifically the principle of autonomy, in the machine learning pipeline. These are the learning objectives. To maximize learnings from this module, we encourage you to pause the video here and take notes of these questions. Then, while viewing this module, listen for the answers, and at the end, take time to reflect on your answers and how the content applies to your work. Let's begin by going over the principle of autonomy and what it encompasses. Autonomy is defined as the right to self-determination and self-governance, and it respects the individual's right to make informed decisions. In the context of healthcare, autonomy is related to the ideas of human agency, dignity, and freedom. These concepts become important as an individual attempts to navigate choices related to how their condition is being assessed and options for treating their illness or injury. In an era of AI, some of these assessments and treatments include technologies featuring AI. Ethical principles can provide a convenient and valuable guiding framework, promoting better technology fit in practice, or as we say in nursing, better fit at the bedside. Developing ethical machine learning healthcare applications requires intentional design. There are some models that can aid the design thinking process, and we've listed them here. Each promotes a unique style and a process, but all share certain attributes. All promote engagement with key stakeholders early in the design process, and all are coupled with variations of designing, prototyping, and adjusting or redesigning iteratively. We encourage you to familiarize yourself with all of these models. However, the models shown here in red are some of the most robust. So we'll briefly describe them to set the stage for thinking about how one might actualize or operationalize the idea or principle of autonomy in a machine learning model. The Stanford system includes 5 design steps, beginning with empathizing. In the empathizing step, the developer meets with key stakeholders to listen to their needs and observe them in situations for which the technology could help. Empathy is the cornerstone of this model, and it embodies the idea of human-centered design. After gaining empathy for key stakeholders, the developer defines the problem, a problem that they will decide to solve for. This step adds boundaries to the problem and allows for a constrained or feasible solution. In the ideate step, the developer envisions multiple solutions, choosing one, and then drafts technical specifications. Before suggesting features or specifications, it is important to take another look at the conclusions drawn during the empathize and define the problem steps, making sure that the specifications and suggested features appropriately align. Finally, the developer prototypes and tests the solution. Typically, this involves several iterations and close contact with stakeholders. According to CEO Tim Brown of the IDEO design thinking model, This model allows people who aren't trained as designers to use creative tools to address a vast range of challenges. IDEO is similar to the Stanford Design System in that you can draw inspiration from observing stakeholders and envision and test a solution before implementing it. It is different in that it adds a reflective process about how the creative journey is going for the designer. Value-sensitive design is different than the Stanford and IDEO models in that it requires designers to incorporate values before the design process even begins. The key idea here is that values are not only built into the technology during the design process, but before designing even begins, starting with decisions about which problems are most valuable to spend time creating solutions for. This design approach considers diverse persons' perspectives on problems and places emphasis on solving universal problems rather than uniquely experienced ones, meaning it seeks to solve problems that are experienced by many people. For example, traffic engineers are often tasked with optimizing throughput of vehicles for an intersection. The value embedded here lies in the very first assumption that the vehicle throughput is the transportation mode to optimize for. If pedestrians were prioritized, the roadway might be closed off to vehicles entirely. The bottom line here is that various groups will value and prioritize things differently, and value-sensitive design aims to consider a variety of these perspectives and choose the one with the most common good. Reflexivity is a practice that can assist with values-based design or IDEO or Stanford or any design model that you would choose to use. Reflexivity is the process of becoming systematically aware, self-aware, of one's own identity, positionality, and subjectivities. It is an ongoing and active process that can illuminate developers' personal values and biases. Questions to ask yourself as part of a reflective practice include, what are my motivations for developing this machine learning healthcare application? Am I fitting the problem to the tool or the tool to the problem? Who do I envision using the product? And what am I assuming about them? Some additional guidance that can be helpful when thinking about intentional design comes from the European Commission on AI. The next few slides are dedicated to briefly discussing each of these ideas, and then we will share a few ideas on how to actually embed the principle of autonomy in the machine learning pipeline. Trustworthy AI requires maintaining human agency. AI systems have the potential to subtly manipulate human decision-making, so it is important to design systems that do not unwittingly manipulate. To support human agency, developers can use 3 different types of human oversight in design and during use: the human in the loop, human in command, or human on the loop. For the human on the loop, this is where a human monitors the system's operations. With human in command, the human oversees use cases of an AI and assesses broader economic, societal, legal, and ethical impacts. The human in the loop is where humans support interventions and are part of every decision cycle. This is the one most associated with design and development. With the human in the loop, accuracy is huge. Every decision made along the data collection pipeline influences the ultimate outcome. For example, with health technologies evaluating gait, many are embedding gait analysis in smartwatches. or devices that are put on arms. But research shows that you cannot accurately analyze gait with sensors on an arm. Instead, you need sensors on the torso, legs, and/or the ankles, preferably all three. In the real world, however, it is not practical and it is expensive to place sensors all over the human body. Decisions must be made balancing accuracy and feasibility. Accuracy decisions made in the development of some commercial devices have led to inaccurate suggestions to users made by those devices. These include too much pre-processing of the data and smoothing of values like heart rate variability, where the data is smoothed to the point that the information provided to the end user isn't really helpful. During design processes, it is also important to include safety features so the system can robustly ward off malicious hacking. This includes standard security, but it also includes systems that are continuously learning. It includes protecting the system from data poisoning, either intentionally or due to exposure to unexpected situations in the self-learning environment. These questions can help with thinking about designing for privacy. Maintaining users' privacy is important to maintaining their autonomy because without the ability to keep information private, aspects of self could be used by others to manipulate decisions. To lose control of one's personal information in some measure is to lose control of one's agency and dignity. So privacy is necessary to protect our fundamental right to autonomy. Transparency requires developers to keep an audit trail for all decisions made in the designing of the model. From data cleaning to which techniques and tools were used to solve the problem. The audit trail is critical information about why a model made a particular decision, as well as being able to explain how the model might influence human decisions. Communication between developers and stakeholders is key to transparency. Telling the truth about a product's limitations and not exaggerating or engaging in overreach will be key to supporting human agency. Obtaining and using diverse data should be a main goal for all developers. Many real-world data sets reflect historical and systemic biases and disparities, which should not be perpetuated. For example, research has shown that racial disparities exist in measuring and treating pain, especially for the African American community. Lots of care should go into rectifying such biases by carefully curating data sets to have equal class representation for minority groups and data points which accurately reflect their experiences. The environmental impact of large AI systems is also becoming increasingly relevant and must be considered in all steps of the design process. We should be asking, can the system be designed for less energy consumption and less energy harvesting? More effective energy harvesting, including solar, thermal, mechanical, and Wi-Fi, could all reduce the energy consumption footprint while still supporting large sensing and computational efforts. Here, thermal involves converting temperature differences between the body and the environment into energy. Mechanical involves converting movement into energy, and Wi-Fi involves converting signals into energy. And finally, according to the EU Commission, extra attention should be given to any AI system with the potential to influence the free democratic process. Finally, all AI systems must be internally auditable so that the people in charge can have a complete and thorough understanding of how the system is operating and performing. In the context of U.S. healthcare, the FDA and other regulatory bodies may need to perform audits or tests. However, the gold standard would be to have locked down yet open source code that can be independently audited by anyone. And when things go wrong, end users should know about the thing that happened, and they should have options for redress. Now let's discuss a few activities that will help with operationalizing the principle of autonomy in design. Here we move the conversation from just a conceptual one to answering the question, how do I do that? It's easy to imagine supporting a person's autonomy if we're thinking about building assistive health technologies like a new walker or apps supporting brain health for persons with early dementia to help maintain their independence, or designing smart homes for aging in place. However, in the context of healthcare, the idea of autonomy is more nuanced than these examples suggest. We need to consider each phase and component of the ML pipeline to envision how we actually embed ideas of autonomy into a technology's design, from the data used to train the model to the decisions about which model to use to solve the problem, to implementation and thinking about who the end user will be and when and how they will use the health technology. For the first intentional design activity, we suggest breaking the system's design requirements into two categories of imperatives: whitelist rules and blacklist rules. Whitelist rules are those behaviors that an ethical system must always follow. Blacklist rules are behaviors the system should never, under any circumstances, perform. Then we suggest using the Sense, Plan, Act framework to conceptualize the parts of the AI system that must be designed with ethical principles in mind. First, the system should be able to sense or have access to all information to adhere to any whitelist requirements. Second, the system should only consider plans that adhere to the whitelist requirements. And finally, the actions of the system should be restricted to only those behaviors that realize the system's requirements. Obtaining user feedback, especially from marginalized groups, should be continuously solicited and acted upon. Another intentional design activity that can help with embedding autonomy in your design is to add a run-through of the EU's guiding concepts covered above to each phase of your design to ensure that your design addresses each. In our experience as neuroscientists working with engineers to develop machine learning healthcare applications, we've learned that there are a few things we can do to ensure a client or stakeholder comprehends the technology. Stakeholder comprehension is especially important when the stakeholder is an older adult managing multiple chronic health conditions. We've discovered that trust is a key factor when someone is being asked to consent to the use of a machine learning healthcare application. And we've successfully built trust many times by implementing the techniques that are listed here, like slowing down and taking the time to speak in simple terms, and continuously watching for clues that the client is understanding what you are saying, or if they are confused. Speaking in simple language. Practicing this ahead of time can be really important because after you've been in the design and development phases for many months, it's harder than you think to speak to a stakeholder in lay language. It's also important for building trust to listen and confirm that you are hearing what you think you are hearing from the stakeholder or client. We suggest using these techniques in the prototyping and testing phases of your design to set yourself up for successfully obtaining consent in the real world, where healthcare and patients are managing a lot of life complexities. Finally, ensure end users always have access to a product expert, someone who can provide information about the machine learning healthcare application's purpose, scope, potential benefits, and its limitations. That might be you, or it might be one of the experts on your team. As Dr. May indicated in the first module, this is like a patient being able to meet with a brain surgeon before having surgery. The patient will not understand exactly how the surgery works, but they will have the ability to ask questions of the expert, and this is considered a fundamental right. This access is the embodiment of offering autonomy, agency, dignity, and freedom of choice to the patient, the participant of a research study, or a stakeholder. So in this module, we've explored design thinking principles and asked you to envision how the bioethics principle of autonomy can be applied when developing machine learning healthcare applications. And we shared 4 ideas for operationalizing autonomy features in your application. Please reach out if you have any questions. And just a few references to assist you. Thank you for taking the time to join us for this module.